Hi everyone, in this video I'm going to give you some information on gingivitis and gum inflammation. So you've been to your dentist and they've said that you have gum inflammation, redness or gingivitis. Don't worry, it sounds much scarier than what it actually is, and it is reversible. So gingivitis is the reversible inflammation of your gum tissues that surround your teeth. So what can happen when you brush your teeth? You might experience a bit of bleeding, or when your dentist does his gum measurements, he notices a bit of bleeding on probing when he measures your gums. This is a sign and indicates to us that you might have gingivitis. So I'll go into a little bit more detail on how it can happen. So within all of our mouths, we've got lots of different bacteria, good and bad, and they all work together as a community called a biofilm. And this biofilm forms all the way around your mouth, on your teeth, tongue, gums and cheeks. So this biofilm, throughout the day and overnight, it starts to mature and it will start to attach to your teeth. Once it's attached, then it's called plaque. Plaque is this soft white stuff that sometimes you can feel on your teeth. It feels a bit rough. So plaque is the stuff that you clean off twice a day when you clean your teeth. Brushing alone will remove 60% of the plaque on your teeth. 40% should be cleaned off with floss or interdental brushes once a day. So sometimes if this plaque is not cleaned off, it can start to irritate your gum and cause gum inflammation and redness. You can see here the gum becomes a little bit red. So when the dentist measures and prods it during a checkup appointment, it might bleed. So what is happening here? So there is some plaque on the gum or the tooth, and our body knows that it's there. So it tells our blood vessels within our gums to puff up and dilate. We call it vasodilation. And this is telling the blood vessels that they want to increase blood flow to the area because your body feels like it wants to clean away that plaque. So where the blood vessels are now dilated, they're closer to the surface. This makes the surface appear red or swollen, and it can make it more fragile. So when you brush or floss, when you spit, you get a bit of bleeding. Don't worry, this is reversible. So if you ever experience this, clean there a little bit more or a little bit longer, not necessarily harder, just a little bit longer over the next 3 to 5 days, and your gums will reverse back to being pink and healthy again. There are some exceptions. So if you are a smoker or use a vapor, then the nicotine within can constrict those blood vessels, so you don't actually know that there is a problem there, because your gums will still be pink, but they'll be unhealthy and you won't be able to recognize this. So that's why it's really important, if you are a smoker, that you have your regular dental checkups every 6 months so they can pick this up. There are some factors which can increase your risk of gingivitis. One of those is calculus. So if that plaque is left on your tooth surface over 48 hours, it can bond with the calcium and the minerals in the saliva and create calculus or tartar. Calculus are little yellow hard bits that you cannot remove with your toothbrush. That's what, as a dental therapist or a dental hygienist, we can clean off very gently. Calculus doesn't cause gum inflammation, but it does get in the way. It is an obstacle, so plaque can cling on to this calculus and increase your risk of gum inflammation. Other factors include poorly contoured fillings, or if you've got a lot of crowding of the teeth in the mouth, or medical conditions such as diabetes, menopause, pregnancy, certain medications causing dry mouth, as that reduces the salivary flow in the mouth, so not washing away the plaque as much. Other factors can be poor diet, stress, and age, leukemia, adolescence. There are many factors. So it's really important, if you do have diabetes, say that you are seeing your dentist and dental therapist regularly. If you have a dental implant, then it's extra important that you see your dentist and dental therapist regularly. The differences between an implant and a natural tooth: a natural tooth has these little ligament fibres, so there's a bit more give and take. whereas an implant goes directly into bone tissue. It screws into the bone. So if you get inflammation around an implant, it is more tricky to reverse. So your dental therapist can help you with that using some airflow or cleaning products around. I hope this video has been helpful, and if you have any more questions about gingivitis and reversing the process, get in contact. I'm the Pink Dental Therapist, and you can find me on Facebook, Instagram, or I'm at New Street Dental Care in Andover.